Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Moving from home might foreshadow better health in old age, experts say. Breaker number 148. Moving away from a hometown can be a bittersweet experience, as people leave behind familiar comforts for a fresh start. Break it also might be a sign of better future health, a new study says. Break Americans who migrate within the United States have significantly better health than those who remain in their birth state, researchers reported October 15 in the Journal of Ethnic and Minority Studies. Break people who stayed put were more likely to become disabled as seniors, with a higher risk of vision and hearing problems, cognitive impairment, limitations in daily activities and physical weaknesses like difficulty walking or climbing stairs, researchers found. Break and number 156, we found that older adults who stayed in their birth state had up to 22% higher odds of disability than internal migrants, and number 157, said lead researcher Catherine Nollin, a graduate of the University of Toronto Factor in Wentash Faculty of Social Work. Break and number 156. This study provides the first large-scale evidence that internal migration in the U.S. is linked to better health in later life, and number 157, Olin said in a news release. Break for the study, researchers analyzed 10 years of data gathered on 5.4 million older adults in the U.S., comparing disability between people who remained in their home states with people who moved away. Break results showed that people who left their home state had better health and less disability. Break researchers suspected that education might play a part. However, taking people's education levels into account substantially reduced and number 147, but did not eliminate and number 147, the observed health advantage, researchers found. Break and number 156, educational attainment appears to play a dual role, and number 148, both increasing the likelihood of migration and offering protection against disability, and number 157, researcher Alyssa McAlpine, an FIFS graduate, said in a news release. Break and number 156, however, internal migrants remained healthier even when we adjusted for education, which suggests that other factors like self-selection are also at play, and number 157, McAlpine said. Break, in other words, healthier people might choose to migrate, while those who are less healthy might stay put because moving would be too taxing, researchers said. Less healthy less than /speak people also might choose to move back to their home states. Break the team also found that immigrants from abroad had even lower odds of disability than internal U.S. migrants, with 7% to 33% lower odds of 4 types of disabilities and number 147, hearing problems, vision problems, cognitive impairment and mobility problems. Break and number 156, this stronger health advantage among immigrants points to a more intense selection process where unhealthy individuals are less likely to overcome the multiple challenges of international migration, and number 157, said senior researcher Esme Fuller-Thompson, director of the Institute for Life Course and Aging at the University of Toronto. Break and number 156, barriers such as cost, distance and immigration policies likely reinforce this selection effect, and number 157, she said in a news release. Break overall, the results suggest that moving between states might signal a person's resilience and their desire for opportunity, researchers concluded. Break sources: University of Toronto, news release, October 15, 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. More news resources: for MedWatch, Drug Alerts, Daily Med News, news for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break whatever your topic of interest. Subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.